Dr. Mihaela Druta, thank you so much for joining me live in Dallas, Texas, to talk about such an important topic today. I really appreciate it.
Thank you so much for having me here for July Sarcoma Awareness Month.
Tell us, let's do the basics. What is sarcoma?
In general, soft tissue sarcomas are very rare type of tumors. They can arise anywhere in the body, and there are over 50 different subtypes of soft tissue sarcomas. They have a different behavior and different response to different therapies. That's why it's extremely important for the patients that are diagnosed with soft tissue sarcomas or synovial sarcoma to be evaluated in a tertiary cancer center where we have a team of experts that are specialized in this rare type of tumors, and they can confirm the diagnosis and personalize their treatment options for the patients with sarcomas.
Doing these interviews every day, I've been hearing a lot about biomarker testing. Tell me, should this be a process with sarcoma that doctors should consider?
Absolutely. So let's start to define what is a biomarker. It's a biological substance. We can be a protein or a gene that is found in the patient's blood or can be found in the tissue. And early testing with these biomarkers can give us a further information about the patient's diagnosis, refine their diagnosis, but more importantly, it's giving us a more informed treatment options for the patient. It is extremely important for the patients to have this biomarker testing early on in their diagnosis, not only for having a better understanding of and refining their diagnosis, but also for opening the opportunities for the patients to be evaluated for clinical trials and even for FDA-approved treatments.
What is the process for this biomarker testing? And once you've got it, what are the results supposed to yield?
Yeah, so when in general for patients with cancer and also for patients with soft tissue sarcoma and synovial sarcoma, they should start the conversation with their medical oncologist and see if they are eligible for a biomarker testing. And if they're deemed eligible, that they can have a blood sample, or this can be done on their tissue. And the results, they're taking around 2 to 4 weeks to come back, and they will come and then meet again with the treating team and formulate the treatment plan.
With synovial sarcoma, what are some of the symptoms that either the patient will notice or the doctor will bring to light?
So sure, synovial sarcoma, it's a rare and aggressive type of tumor. Again, they can arise anywhere in their body, but mostly they are presenting like a painless lump around one of their large joints, such a knee or a hip or the shoulder. Sometimes if they are located closer to a nerve structure, they can cause pain, and the patients, they will be evaluated by their primary care physician, and they will have further diagnosis testing in these circumstances.
You've given us a little bit of information on this. This obviously requires a lengthy consultation. Where can my audience find more information about this?
Definitely there are a lot of great resources out there. Going to specialized sarcoma center once they have even if it's a possibility for a sarcoma diagnosis. And for biomarker, it is a sarcomabiomarkertesting.com that it's a great resources for our patients.
I'm going to take this one real quick before I let you go from Facebook. The poster wants to know, are there any trials for any answers to our sarcoma?
Yes, there are trials that are available for patients with soft tissue sarcomas, and they are actually conducted in this big tertiary cancer center where we specialize in this type of cancer, and we can evaluate the patients to see if they are eligible for these trials. That's why it's extremely important for the patients to come and see us and see what other treatment options, including clinical trials, are out there for them.
Dr. Druta, thank you so very much for this information. You probably help more people than you know. Have a great morning.
Thank you so much for having me here.
Hi, I'm Valder Beebe, host of The Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebe Show. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/ValderBeebe Show and stay connected as I interview the world's most fascinating people.